Hello to everyone. I'm Cyndi Lynne. I'm an integrative life coach, and I'm really excited about having this opportunity to tell you what I do today because what I'm going to share with you is something fairly new. And it's something new that's come out of my time with Cornelia and with Diane, and especially after working with Susan, who was very generous with her time. So, in the most simplistic terms, I help women navigate their diagnosis. I help them answer the now what. And as to my why and the importance of that is I've seen so many women follow a prescribed path throughout a diagnosis, throughout treatment and therapy that wasn't theirs. And they arrive at the end of that path feeling not only victimized by the illness, but victimized by what was supposed to have been the answer to the illness. So when you get that call, or when a family member gets that call and they hear those test results and they hear those words that we all hope we never have to hear, life stops for a moment. And then it usually turns in a very different direction than we would have ever planned or ever wanted to take. And the feelings that come from that are disbelief and anger and confusion, denial, all of these different emotions. And they're all perfectly valid emotions, and they're all perfectly normal emotions. And the one thing they have in common is when we feel these very strong emotions, we're not able to absorb information and we aren't able to process that information and use it in a meaningful, decision-based way, like we're usually used to doing in the rest of our life. So this makes the situation that my potential clients, that these patients are in, very different, very outside of their normal life. And I find this is especially unfamiliar and it's especially frustrating to professional and executive women who are used to being on the top of the information change and used to being in control and making their own decisions. So think about this. If you were facing a diagnosis and you wanted to regain that sense of control and you wanted to feel confident in your ability to gather that information and to make your very best decisions, I would invite you to work with me. And our work together would be very different than perhaps what you've seen others do or what you've had in the past. I know that there are very good care coordinators out there within facilities and medical systems, case managers, but the biggest difference is that I'm completely independent of any healthcare system or facility. And that really gives a freedom for me to work for you. And the other thing that's very different is that I come from a very strong nursing background in cardiology. I have worked with the FDA on the business side of medicine. And I've also worked with and have an amazing toolbox in things like yoga and Pilates, Reiki, these other practices. And I bring all of that to the table. So if you're looking for help navigating things, one of the very first things we do in working together is consider your personal philosophy of care. And that's going to be a big divergent thought for a lot of people because a lot of people think about philosophy of care as something that a physician would hold. And yet we each have our own. And we may have never explored it. We may never have asked ourselves the questions that lead to that. That's the basis of the work that we would do together, navigating your diagnosis. So thinking about your philosophy of care, and I want you to kind of go through this exercise if you haven't before, because it will really put you in the place of understanding how to use the services I provide. I want you to think about either a diagnosis that you've had or someone close to you has had, and think about what the outcomes you would want from treatments or therapies you may choose. So the first thing that comes to mind is, well, I want to get better. But I challenge you to go a little bit deeper and think, what are the outcomes I want from this diagnosis? And this work is really important because then you can go on to choose a physician and healthcare team members who have the same philosophy of care, and then you know you'll be working towards the same goal. So because this is such a shift in paradigm for people, it's an area that I can really strongly help guide them and facilitate the process. So once you determine that, once you can start looking for your care team, there's a lot of other considerations that come into play. And I thought about talking to you about this today, and rather than listing the individual components of the service that I provide, I thought I'd share a quick patient story with you, a patient who became a client of mine. So this was an 84-year-old woman who I'll call Sarah. She was asymptomatic, doing pretty well, living on her own, and she was diagnosed with breast cancer after a routine mammogram. And those of you in the healthcare profession may already have a little flags coming up. I understand that. But I was called in because her adult children, very well-meaning, couldn't decide what they wanted Sarah to do. So the doctor who diagnosed her with the cancer offered her surgery and assured her it could be scheduled immediately. And then they assumed there would be a radiation evaluation after that. Didn't anticipate chemo would be necessary. So that's a pretty typical medical model of what a patient would be presented with. So when I came into the relationship with Sarah and her family, it was really clear that she didn't want any of it. But she was also very concerned about disappointing her family. She didn't want her family to think that she had given up on life. So she was feeling pressured. The family, on the other hand, wanted the best treatment for her, but they were really worried about their mother undergoing surgery, given her other medical conditions. So you can kind of get a sense of this push-pull that happens not only within relationships in a family, but with the medical system. So I sat down with Sarah and I asked her how she wanted to take care of her body. And she said she didn't want pain. And that was no surprise. And because she wasn't in any pain as it was. She didn't think she had the energy to battle cancer. So there's a real paradigm, a real story that a lot of people have about battling cancer. And she didn't think she wanted that. But she really wanted to live in her apartment on her own as long as she could. And she was worried that treatment would result in her ending up in the nursing home. So I asked her if she and her family had considered getting a second opinion. And they said they had. They talked to another oncologist within the clinic, and he had the same diagnosis and the same recommendations. And I talked to the family about how medical systems work and helped them to realize that they hadn't really gotten much of a second opinion at all. And it's not uncommon for clinics or groups of physicians to have very similar philosophies of care. And these physicians also have similar sets of tools that they have access to. So these physicians, like all of us, use the tools that we have. So when I talked to them about a second opinion, I recommended getting a consult with a gerontologist. And at the same time, obtained assurances from Sarah's current physician that taking the time to do this wouldn't present any extra risk for her. Just that few extra days wasn't going to change her outcomes. So first of all, amazingly, just the simple act of taking that time pressure off, of allowing Sarah and her family to take a breath, meet with another physician in a few days, seemed to really de-stress a lot for them. And I realized at that point that they, like many people, felt like they were in an emergency medical situation. And they were not at all. This was a serious situation that definitely needed their attention, but it wasn't a medical emergency, which means they have time to think and they have time to learn and they have time to make a decision. And as I suspected and had hoped for, because I'm not unbiased in these things, the gerontologist reviewed all of Sarah's medical records and he spoke with Sarah and the family and, bless his heart, very eloquently assured them that cancer, even if left untreated, would not be the element that would contribute to an earlier death for Sarah. So as a result, she was able to return to her apartment. And the last I heard, she was doing really quite well. And that navigation resulted in essentially no treatment for her cancer. And that was a decision that she and her family both felt good about, which isn't always the outcome. There can be a struggle with that, but they both felt really good about that. They felt like they were doing what they needed to do. And things went really well. So from a retrospective kind of look, what kind of things did we navigate? What kind of things did I help the family navigate, as well as Sarah? With my knowledge, with my background and my support, they were able to define their desired outcomes, both Sarah and her family. Sarah was able to communicate her desires to her family in a way that didn't make it sound like she was giving up, made it sound like she was clear about what she truly wanted. They were able to shift out of the emergency mindset and into a mindset of thoughtful decision making. They were able to understand what obtaining a second opinion really meant and gain access to a whole different specialty that they weren't even aware of. And Sarah made her decision very confidently and appreciated that it was in harmony with her family, but that it was still her decision. And I think most importantly, she got to return home. Now, essentially, this process in some form is what I offer all of my clients. I help them answer the now what that comes after those words, after that phone call, after the things that none of us ever want to hear. And I bring the best of 25 plus years of nursing and health coaching. And right now, as my new program, I'm offering the support in a highly focused 1-day intensive. And for those of you who are process oriented, we give you an opportunity to determine your outcomes and your philosophy of care. We identify critical members of your care team. We develop and I provide tools so that you can interview and assess each member of that care team. We determine the need and the value of getting a second opinion and the process of how to do that. We also identify sources of personal support and, most importantly, how each of those individuals, be it family members or friends, can best contribute to your support. Because when you know how to ask for support, your chances of getting exactly what you need increase tremendously. So each client leaves with a detailed plan, the next steps, the confidence to carry out that plan, and then checkups and follow-ups with me over the next couple of weeks. So this is support, this is strategy, this is building confidence with these clients. So if you or anyone you know is currently facing a diagnosis and it's new and they don't know where to start, or if they're managing a diagnosis and they don't feel like it's on target, but they don't know how to shift that path, I guess you could call me your now what nurse.
So
So
good.
thanks a lot for listening, and I'd be happy to answer any questions.